Hello everyone, welcome to Log Easy Medicine 003 YouTube channel. So in this video we're going to discuss about a case study which has been already posted in the Instagram page Easy Medicine 003. So hope you guys have gone through the questions before coming to this video. So in the post actually we have I've put up questions on a patient comes with bleeding, so rectal bleeding, hemorrhagia. So the first question was the 4 differential diagnoses for the painless hematochezia. So usually if the patient's complains of bleeding rectal or during defecation, so the main differential point for the hematochezia is it painful or painless. So if it is a painless conditions, there are a number of differential diagnoses for it. So it is not to say like it is common actually, but then it is important to us to put it in the differential as well. It could be a colorectal carcinoma with other risk factors as well. And the next is inflammatory bowel disease, diverticular disease, and then fourth one hemorrhoid, which is common, basically comes with bleeding, rectal bleeding. So that's for the painless condition. If it is painful, it is more focused on the anal region or localized. So it could be anal abscess, fistula, fissure, or maybe anal carcinoma. This is the severe form of it. So we just ask for any risk factors so that we can actually diagnose the condition and treat accordingly. So the next question was 3 risk factors for colon carcinoma. There are several risk factors for colon carcinoma, but I've just put up 3. Maybe you guys can add on for your own study purpose. So the first one which is age, more than 50 years old. And then we're gonna ask about your diet, if they are taking low fiber diet, low vegetables, green vegetables, and taking high contents of meats, red meats, so on. So it could be a risk factor for colon carcinoma. And then the family history is very important, and if they are relative, first degree relative having this colon carcinoma, so we need to suspect for this patient as well. And then the fourth questions was actually a kind of focus question. The investigation we could do if it is a rectal mass, if it is suspect to be a rectal mass in this patient. So I've put up 3 investigation over here: proctoscopy, colonoscopy, and CT scan. So for the proctoscopy, we're just gonna examine maybe for the location of the mass and how it looks, so on. And for the colonoscopy, it is a gold standard considered for colorectal carcinoma. So we can actually take a biopsy for staging as well, and then we can actually check whether carcinoma, and then we can also check whether it's localized or spread to any other parts of the colon. And then the very important one is CT scan. So if it is a rectal carcinoma, we need to actually check the spread of the tumor. This CT scan helps us to actually check for it. So that's all for the investigation. You can actually add on as well. So I just put up 3 investigations, so that's why I'm discussing only 3. And then come to the management part. It is just a very brief management for this patient if it is suspect to be a rectal mass. So once we got to know the staging, so we can actually treat the patient accordingly. So under which treatment they come, so for every carcinoma, mostly there'll be surgical, chemotherapy, and radiotherapy. So under the surgical method for this rectal mass, we can actually do the anterior resection with or without J-pouch. So usually patients are recommended to undergo this with J-pouch anterior resection, which is a sphincter saving. And then the next one could be abdominal perineal resection, which is a removal of the anal sphincter. So in this condition, the patient is going to have their lifelong stomach bag if the rectal mass involves the lower third of the rectum. So we need to advise the patient accordingly before doing this procedure, so on. And then comes to the chemotherapy. So for the chemotherapy, if there is any nodal involvement is there, we're gonna do this chemotherapy. Usually Duke's secret criteria of the TNM for could be for this chemotherapy as well. And then the last one is radiotherapy. It is for any recurrent tumors it keeps coming, and yeah, so we can actually do this radiotherapy. So these are a brief discussion on rectal bleeding, lower GI bleed. Hope you guys enjoyed this video. If you guys like this video, please don't forget to like and share to your friends, and yeah, please subscribe as well. Thank you.